And one of the things that troubles me, I think, is when we talk about, say, cuts, we have to start talking about what it means to people. And when you don't have enough reviewers at the FDA to look at complex medical devices, you step backwards because things aren't going to get approved, or something gets approved without a thorough review. And it's one of the most amazing things how we're on this cusp of, I would say, a next generation of technology because of mapping the human genome, because of AI, if harnessed correctly, all these things with rare diseases, and yet they're going backwards. Could you just talk about that more macro issue of how not having reviewers or scaring people away from the workforce because you diss the workers, even if you don't fire them individually, the effect that could have on America's economic future?
Sure. You know, I'm spending more time than I wanted to paying back what I call debts that I had when I was commissioner. I couldn't go out and give talks at universities except, at particular times. So I've been all over the country, and I think there's a general agreement in the biomedical, scientific, and patient communities that we are at the most exciting time in the history of the possibilities that we have to cure rare disease and to do a lot about chronic diseases. And a big part of that you referred to is the evolution of devices now from sort of mechanical instruments to now instruments that are armed with artificial intelligence and digital technologies of all types built into the devices. And you spoke about reviewers, but again, as I've been focusing on, it's not just the reviewer who's looking at the data coming in. It's all, in the case of devices, it's the biomedical engineers, the physicists, the quantitative scientists, the data scientists who are working with the companies all along.
Or working with places like Mayo Clinic in Minnesota with the research, which was so integrated with NIH.